Hi, this is Dr. Ben Rader with Dr. Mike Zussman on behalf of Wisconsin Psychological Association's Public Education Campaign. Today we're going to be talking about what mental health professionals can do to make themselves ready now for the coronavirus and the new needs and demands that this pandemic has placed on all of us. Hey Mike, how's it going there?
Good. How are you doing, Ben?
I'm all right.
Good. Yeah, this is nice that we're able to do this and not have to worry about anything.
Yeah, it is. And this is a kind of a model here that you and I have both gotten familiar with more recently now.
Yeah, we've had to. It's been trying. I was kind of curious, what are you doing on your end? Like, how did you prep for this as far as your practice?
The first thing is we saw this coming, fortunately. And it has been helpful. I've been in communication with my clients throughout the process. We were talking about it at a clinical level, what it means for people, but then it started moving into this kind of practical level. And then it started dawning on myself and others at my practice that, we're going to have to start approaching things really different. And as soon as we started realizing that, we decided this is the time to look at telehealth as being a default approach here for us to be kind of taking as a mental health providers. And even as you're talking here, you hear my computer's buzzing here. I'm getting updates about the COVID as we're speaking. COVID-19. It's just kind of hanging like a cloud over all of us. So. Anyway, my practice here is really decided to go to a fully capable for full telehealth, and that basically means is we have to get a platform where I can talk with my clients in a way that's secure, but also in a way that's face to face. Some of my clients don't have though technology available for them so that they can do something like this. So in those cases, we've also been using just telephone conversations. And one of the things to know is that these platforms, although they're really helpful, the Medicare and Medicaid have come through recently and have given us a green light to communicate in whatever means that we need to with our clients, because that's something that we all know not everybody has the same technology access, and maybe people don't even have access to Wi-Fi during this time period.
Yeah, and that's not always been the case. It hasn't always been so easy to do telehealth.
No, it hasn't.
Telehealth has been, it's a fairly recent thing as far as the field is concerned, and a lot of, myself included, a lot of other people have been really hesitant to use this,
right? Just
because of the HIPAA compliancy and, any kind of privacy issues or anything. So I know there have been some changes. What changes have happened as far as at the federal level, local level, that allows us to do this?
Sure. Well, it's as with any situation like this, all parties are kind of alerted to a common concern. And the common concern right now is, although things like privacy will always be an issue, and things that we're kind of and mindful of, and frankly, a lot of these platforms that are available have been and continue to be really airtight in terms of HIPAA compliance and making sure things are safe in terms of information. I think what's changed is largely perception, and that is at one point in time our perception was without any other variables or concerns or stressors. Our focus was entirely on things like HIPAA, and that was the only variable that seemed out of our control. Now we're at a point in time where there's this virus, there's a pandemic, and we all start feeling more and more out of control in terms of our physical space and our safety. And we are realizing that our clients are vulnerable in a different way. And this has kind of allowed us all to revisit things like telehealth and to force us to kind of get our mind around it, And I think that's been a good thing. And what has come along with that is governmental entities like Medicare and Medicaid in particular, basically green lighting now. In the past, it's kind of, it was a hit or miss who was able to access and use telehealth, and a lot of the insurance entities were were not comfortable with it. Now the insurance entities want to make sure people are not going to contract this virus.
Mm-hmm.
You know, so they're motivated now to make sure that people are their clients are still getting mental health services, because you don't want that to be something that people are without during a crisis. And they also don't want to force people into the community sector and expose them to the virus.
Right.
You know,
Yeah.
so it's like
that's the whole idea of it.
right.
Yeah.
That's right. You know, so it's this kind of this moment where everybody's a moment of clarity where everybody's saying, you know, this seems to be something that we need to revisit, and everybody's and for the most part, all the insurance platforms that I use right now, within a week, all green lighted telehealth. So that was pretty big.
Yeah, a lot of them have actually backdated that to March 6th. I've seen.
Wow. Okay.
Where they've accepted it, and I know a lot of restrictions as far as like location of where you can do telehealth.
Right.
Because it was in the past that in order to do telehealth, the client had to be in an office location that you had set up. And you yourself couldn't be in that, you had to be somewhere else. And I know that they've lifted all those kinds of restrictions too, where the client can do this from their home now, and it's compliant.
Yeah, that's right. You know, my clients, sometimes will be wearing their pajamas, and I'll know they're in their kitchen or their living room or something. You know, many of my clients have apartments and they're small spaces or whatever, and they're not really able to get out, but they need to see me. And it's been really interesting is how we've really connected. And even clients that I thought were not going to take well to telehealth, it turned out that I almost had better sessions this past week, maybe partially because of all the anxiety and everything, but connecting with people over telehealth than I had previously in my office. I think people have just been really focused on the news and what's happening, and they've been waiting to hear my perspective and to connect with me, and they weren't going to let this get in the way. So I found it's really good. Another thing you mentioned, logistics, modifier codes. So these are things that so if you turn to your professional organization, whether it's Wisconsin, if you're a psychologist, psychological organization, or if you're a mental health provider under LCSW or LSW, LPCs, looking for your professional organization, they will have the answers on this. It's a really good place to go to get some perspective. Usually, all organizations will have somebody that kind of is the go-to person on this. The other thing too is you can just call the payer themselves and find out what modifier codes you need to be using. This really shouldn't prevent any of us from seeing our clients. We all have to deal with billing glitches at times, and I think the main thing is you can't bill for a session that you didn't have. So continue having sessions, continue seeing your people. They need us out there, and that's what we're here for.
And that's absolutely true. And I just want to add one more thing that's really important is this. We need to be consulting with each other. And I know I've had questions. I've been in contact with a friend of mine who's a psychologist and seeing what they're doing at their clinic. And, what I thought was the right code to be using, she's been able to say, oh, no, actually, we need to be doing this code. And I've been able to tell her, well, you need to make sure to change your office location from a 1 to a 2 as a modifier. And so I think what's important is that we are all helping each other out as the professionals.
Yeah, that's right. This is not a time to be territorial or think about your practice. This is really a time where we've got to be reaching out to one another. And frankly, Mike, it's good to talk to you today about these and to get some affirmation. It's also good just for me to have you and other colleagues nearby that I can process the complexity of these cases and my own vulnerability, because this is kind of scary for us. And I think we've got to be strong for our clients and for the people we're serving. And that means we have to be taking care of ourselves. So
absolutely.
Cool.
Yeah, couldn't agree more.
I'm glad to see you, Mike. And I know we're going to get through this. And I'm just glad that we're able to connect in this format here today.
Yeah, and we could do it in our PJ pants, which is great.
That's great. Absolutely. I don't even have a tie on today.
Yeah, there you go.
Take care, my friend.
All right, you too. Take care.
Great.